Hey guys, my name is Ronald Salimto. I'm a registered nurse and also a family nurse practitioner. Welcome to my channel, Nurse Track 101, where nursing lectures are made easy just for you. Well, let's get started. So, right now I'm going to talk about the sign and symptoms of hypothyroidism and hyperthyroidism. So, the first symptoms of hypothyroidism: extreme fatigue. And this fatigue cause somebody to somnolence, somebody to feel very sleepy. So in turns, if contrast for somebody who is hyperthyroidism, of course, there's an extreme fatigue as well, but unfortunately, this patient is unable to sleep. The second symptoms will be extreme muscular sluggishness. Okay, I hope I get the spelling right for that one, sluggishness. And for hypothyroidism will be muscle weakness. And the third one, the effect of thyroid hormone will increase as a positive effect on the heart rate and the cardiac output. So somebody who has hypothyroidism will have decreased heart rate and a decreased cardiac output. And for this one, it's the opposite. You will have increased heart rate and increased cardiac output. Yeah, some patients, patients like I've seen patients with increased heart rate and hyperthyroidism. We will prescribe some beta blockers. And number 5 would be increased body weight. Increased body weight because of lack of there's a decrease in metabolism, so that's why patients with hypothyroidism will have increased body weight. And the opposite for hyperthyroidism, so the patient would have decreased body weight. Okay, number 6, because you know from the effect of thyroid hormones from the explanation earlier that thyroid hormone is responsible for GI motility. So if somebody is lacking thyroid hormone, you will have some constipation. And with hyperthyroidism, you have about varying degree of it's a varying degree of diarrhea. Sometimes I don't have diarrhea. Number 7 would be intolerance to cold. And the opposite for hyperthyroidism will be intolerance to heat. Yeah, it makes sense why patients with hypothyroidism will have intolerance to cold, because thyroid hormone is responsible for body metabolism, and if you lack the hormone, then the body metabolism will slow down, and as a result, there's not going to be enough heat production. And in hyperthyroidism, it's the opposite, is the intolerance to heat. Also in hypothyroidism, you will have there's a greater chance of atherosclerosis. People with hypothyroidism will have atherosclerosis because, as you guys know, also thyroid hormones are responsible for fat metabolism. So they're more likely to get atherosclerosis because of increased blood cholesterol. And there's this one symptom of people with hypothyroidism. It's called myxedema. This is, if you see somebody with, I've actually never seen this, it's kind of rare. This is when you have a total lack of thyroid function, And if you're severely hypothyroid, then you're going to have this. This is if you see somebody with general edematous appearance, usually this is what they have. The exact cause is unknown, but it's argued that this is caused by the increase of high hyaluronic acid and chondroitin sulfate that are bound with protein to form excessive tissue gel in the interstitial space. And this one will cause increase in interstitial fluid in the interstitial space. So if you have somebody like this, this patient is really severely hypothyroid. For hyperthyroidism, this is the most famous one. It's called exophthalmos. This is the protrusion of eyeballs, and this usually caused by the excessive fat tissue or edematous swelling in the retroorbital tissue of the eyes. And usually, if somebody is treated, the symptoms will improve. So those are the signs and symptoms of the of hypo and hyperthyroidism. And let's go to the next slide. So the treatment for hyperthyroidism, I'm going to go over just this a little bit. Hyperthyroidism is the most common treatment is actually radioactive with radioactive iodine. So this will in turn will destroy the thyroid glands. And also you can use doctors will use antithyroid drugs such as metimazoles, and this one is usually given between this is like a therapy of probably 16 to 18 months of treatments. And the last one will be thyroidectomy. So this is the removal of thyroid glands. I usually don't treat this in primary care setting. I will refer the treatments of hyperthyroidism to endocrinologists. So after this one will, of course, remove the thyroid glands with this treatment. With this one and this one, the first and second one, it will destroy the thyroid glands. So the patients will become at the end, the patients will not have production of thyroid hormones, so will become hypothyroidism, and the primary care we have to treat them with the thyroid hormones. We'll have to replace the thyroid hormones. Okay, so now we're going to talk about the treatment of hypothyroidism. As the same as with hyperthyroidism, the lab test that you want to check, that the doctors usually check, is TSH, and sometimes we do T4 as well. So there's one lab that you can use TSH included. Free T4 included with the TSH. So usually the normal value for this one is about 0.5 to 4 milli international unit per liter. So the normal free T4 level, usually normal range is between 0.9 to 2.3 nanogram per deciliter. Let me talk to you first. This condition called subclinical hypothyroidism. So if somebody has, let's say, if the TSH is slightly high, just slightly high, and the person has normal T4 and no symptoms of hypothyroidism, then we categorize this as subclinical hypothyroidism. There's really no treatment for this. There's only a loose guideline or recommendation that usually if the TSH is less than 10 and the person has normal T4 and no symptoms, we usually don't treat it. We diagnose this as subclinical hypothyroidism. But if somebody has persistently TSH more than 10 or decrease T4, low T4, that means the person has hypothyroidism, then we will treat this patient with synthetic thyroid hormones such as levothyroxine. So you treat it with levothyroxines, or the brand name is Synthroid. Usually start with 25 micrograms, and we'll check again in about 8 weeks, 8 to 12 weeks. Check the TSH and the T4 again. Yeah, I've seen one endocrinologist use this medication called Thyroid Armor, and I don't think this is FDA approved yet. It comes from the thyroid glands of animals such as pigs, and meanwhile this one is a synthetic one. So this one is not really studied well. So but it's his discretion to use it, and yeah, that's the treatment of hypothyroidism. Thank you guys for watching, and I hope you enjoy this video. I also do hope that this video will help you in your studies to pursue a career in nursing. If you guys have a request about any other topics in nursing, leave a comment below. And if you guys share or like this video or subscribe to my channel, it will help me tremendously to create more of these videos. Well, I'll see you guys till next time. Bye.